Hello, welcome back to the Striker Growthcast, the show where we spotlight entrepreneurs redefining the future of local business through innovation, discipline, and service-driven growth. I'm your host, Drew, and today we have exciting guest, Roberto Magana, founder and CEO of NovoSculpt, a body sculpting and aesthetic studio helping people look and feel their best through non-intensive body transformation treatments and personalized wellness. We're going to be diving deep into Roberto's journey, so let's jump into it. Roberto, welcome to the show. How are you doing today?
Thank you very much for having me, Drew. I'm doing very well.
Great. So let's walk it back to the beginning. What sparked your idea for NovoSculpt?
Well, NovoSculpt really was born out of a perceived gap in the marketplace. Body contouring had become commoditized and associated with things like being very painful, being very invasive, and lots of negative things around it, and also relatively unpredictable. So you could go to different places and get different results. Now, about 15 years ago, we came up with a potential solution to address these things. So NovoSculpt started as a technology company in which we developed equipment and processes to fill the gap or the perceived gap in the marketplace in order to make procedures more comfortable, less painful, less safer, and without sacrificing effectiveness. So it was an ambitious goal to start out with, and after all these years, we're here. We're very pleased to be here.
Yeah. I mean, for someone who hasn't visited NovoSculpt, it's a relatively new technology over the past 2-3 years, right? Patent pending. How would you describe the experience and the results you deliver?
Well, to understand the experience and the results, we would need to also understand what the competitor is offering. The experience typically is a very clinical heavy one when it comes to body contouring, normally done in hospitals, and with everything that carries with it, right? The hospital experience is not particularly a pleasant experience. And NovoSculpt differs in this respect because the experience at NovoSculpt is patient-centric in that the experience is considered in every aspect of the process, from the time that the lead or person selects an ad, for example, and they come in, the experience feels less clinical and more like a hospitality type of experience. And this is where these two concepts of businesses sort of merge with each other. Naturally, it's not a hospitality business, but it needs to have elements of a hospitality business to maintain the patient relaxed and comfortable, and not only knowing that they're safe, but also feeling that they're safe. And the bar has been raised across the industry. People expect a higher quality of service, a more comfortable quality of service, and we're up for the challenge. We certainly designed to deliver.
Now, putting it simply, NovoSculpting essentially removing fat from a certain area of the body. Is that done via lasers, or how is that done medically?
But very good question. So NovoSculpt is, again, we need to compare it to its alternatives. NovoSculpt, in terms of its effectiveness, can be compared to what traditional liposuction is. But it's different than traditional liposuction in that the NovoSculpt does not use any scalpels, does not use any stitches. We don't need to use any drains, and very importantly, we don't need to use general anesthesia. So we access fat directly wherever it's localized, anywhere really between the jawline and the feet, and we extract fat from the area. But not only extract the fat, we sculpt what we leave behind. We have the ability of tightening skin at the same time, and we can also take that fat, which is actually valuable fat, and we can move it around, right? So if someone wants a breast augmentation, we take that fat and we can transfer it to the breasts or to the buttocks or to the hips to give people an hourglass shape, which is typically aesthetically pleasing. So it's a very versatile technology that doesn't have the drawbacks of competing technologies or older technologies, right? Liposuction proper in its known form has been around for 40 years, and NovoSculpt is here to disrupt that industry.
Interesting. Would it, my wife is in aesthetics, so I'm somewhat familiar with that world. Would it be in line with like Morpheus and Sculptra in a sense?
No, because not necessarily. Sculptra and Morpheus can be considered non-invasive procedures that really don't access the fat directly. Particularly Sculptra is an agent that is injected into an area that has fat and makes that fat atrophy and absorb. And it has medium effectiveness in terms of, especially comparatively speaking. What we do is that we go into the fat pocket and we take the fat out. And that fat is removed permanently. Those fat cells are gone forever. Now, as far as Morpheus, that has a bit more of a more complex explanation to it. But I will say this: NovoSculpt is, in several respects, several steps ahead of these technologies because of its level of effectiveness. Things like the Sculptra and the Morpheus and everything that we know up until now, in many cases, like cool sculpting, for example, is a good example, require many sessions. The way in which we differentiate ourselves and we make ourselves special is that we are able to remove up to 11 pounds of fat from the human body in a single treatment session. And we do this without any scalpels or stitches, and we do it without the use of general anesthesia, and the patient is comfortable and relaxed and feels virtually no pain. So we're talking about something that's significantly different than what is known.
I mean, for you as a business owner, what would you say the most rewarding part of your business via like helping people and transform their bodies?
There are many I'm very fortunate, I'll be honest with you. There are very many things that give a sense of accomplishment, but it's really the reaction of the patient when they see their own body right after the procedure. People, by nature, and especially in today's world where we're surrounded by a number of gimmicks that promise a whole host of things, people are skeptical of what they can receive. So when you see a patient's reaction to their results, I have to say that that's the most rewarding thing, because we've designed the entire concept around that, the result for the individual. That's extremely fun.
Yeah. So what is your typical client? Let me rephrase it. What type of clients do you typically serve? Is it fitness focused individuals, postpartum, weight loss clients, just professional athletes? I mean, what is it? What do you typically see?
We of course we have also all types of customers. Our most frequent customer is the customer that comes in post-pregnancy. Naturally, pregnancy changes the body, and frequently we want to return to the pre-pregnancy body. And we're able to achieve these things by means of fat removal, skin tightening, fat transfers, all of these things that we do. So the main demographic would tend to be about 80% females right within or right after reproductive age. And we're seeing a growing segment of women in their 20s, because people like the Kardashians and all of these people, brought into the limelight a new type of body, one with a larger derriere and more figurely. So a lot of people that are following trends come to seek solutions to clinics like NovoSculpt. So we're seeing a growing tendency in the younger population to come in for services. And interestingly, about 15% of our clientele is male, and this is also increasing because people are very busy. It's very difficult for people to put the time aside to go to the gym all the time. And NovoSculpt has one of our lines of service is one where we can actually delineate muscle structures. So in the right candidate, we're able to give them like abdominals, like a six-pack, or do a fat transfer to the chest to give it an athletic look. So there's a workaround to going to the gym for some candidates. So that segment is also growing, and I have high hopes for that one because those results are just wonderful.
So so you started the business 2 years ago. What was your initial envision for the company, and how has that evolved to what it is now, or has it changed at all?
Well, initially, even before we started the business, NovoSculpt is part of Novo Technologies. It's initially a technology company in which we developed these processes and these technologies in order to deliver a service with the idea of giving these tools to medical groups and physicians. This changed because we felt that the best way to scale the business would be to deliver the benefits ourselves. So instead of giving the technology to other offices via selling it or creating a franchise, for example, we decided to create our own surgical center to deliver our own service and scale that way. And part of the reason for that is because we determined that the best team to deliver the service is the one that actually invented it. So that's why we decided to keep it in-house and take that route. So we went from going in a lab, if you will, to becoming a service-based business. And it's a hybrid of a technology that we are able to license to someone else, to something that we incorporated into our own clinic and deliver in our clinic exclusively.
So your initial technology company is the company that invented this technology, the sculpting technology?
Yes, particularly the process. NovoSculpt is a merger of technologies that incorporates pre-existing technologies and new ones. So, and repurpose things from other older technologies. And yes, we took all of that and said, we're going to deliver this to the patient directly.
Very cool. I mean, what does the typical client journey look like from first contact to consultation to treatment plan?
Well, initial contact with customers are typically one of two. People who come in as referrals, which is a very big part of our business. We have very satisfied patients who have no qualms about referring us to people that they know, which is it's one of the best forms of compliments that you can get. And the other is via marketing, advertisements. So the client journey is one in which, through the marketing aspect, advertising aspect of it, the first point of contact is typically via an electronic platform. It could be Meta or Google or any of these platforms where people find our advertisements. And NovoSculpt has partnered with companies that use artificial intelligence in order to make the patient or customer acquisition process a seamless one, so that there's little friction, because we understand that part of what quality is not just the service that's received during the date of service, but the service that's received from the very first point of contact until the patient is fully discharged, several months after the procedure has taken place. So maintaining a seamless journey from the very beginning, initial point of contact, speaking to a human being, coming in for a consultation and speaking to an expert who tells them what it is that they can expect realistically, and subsequently booking a procedure date. They come in for the procedure date, they walk in looking one way, they walk out looking a different way, very happy, and subsequently the rest of the patient journey involves follow-ups. We maintain very close follow-ups of our patients to make sure that the progress is the one that everyone's happy with, and we do follow-ups at 1 month, 3 months, 6 months. And at that point, the patient is discharged. And typically, they want to come back for something else. So typically, if they had their abdomen done, they want to come back for their arms or their jawline. And if they're candidates for that, we're very happy to serve them.
Wow. So kind of now transitioning, the aesthetics and wellness industry is evolving fast. How do you see technology shaping its future, and how are you guys using technology to your advantage, including AI?
Yes. Well, for that, I would have to divide the horizon in three. The short term, I would say between 1 and 3 years, I anticipate to see an extension of what we see now, which is technology doing low risk, high reward type of activities. Low risk things like bookkeeping, of course, with human guidance at this point, doing things like inventory management, very importantly, automating customer acquisition processes. That is something that's going to be a great equalizer in the short term, in my belief, because that's going to bring costs down for everyone and tend to raise the bar at the same time. In the medium term, I expect technology in this particular industry to start playing a higher role in diagnostic aspects of treatment. We have already seen several studies in which AI proper has outperformed doctors in disciplines such as radiology. There are physicians who have been trained for very many years, extremely competent people, and AI looking at imaging and being more accurate than the human eye to find issues with a patient's health, which is a very interesting thing. Now, I expect that to be a higher risk but very high reward proposition in the medium term. This is between 3 to 5 years. And this will also include body scanning, real-time body scanning, in which surgeons and even preoperatively can observe a patient's body and determine exactly how much fat is where, how much is visceral fat, how much is fat that's outside of the muscle, between the skin and the muscle. So AI, I believe, is going to help us significantly in that respect.
Yeah, I think so. So looking ahead, 6 to 12 months, what are your biggest goals for NovoSculpt? I imagine finish that patent pending process.
Yes, that is a bureaucratic one. So that largely depends on government agencies completing the process, the review process. We're extremely confident that our differentiators are ones that will grant us what it is that we're seeking. In the next 12 months, we have the ambition of opening a second surgery center, also in the Northeast, place to be determined as of yet, but that is, at least in the short term, what we anticipate will happen, and we're very enthusiastic about it, to bring NovoSculpt closer to new communities in order for them to benefit from our services.
So who are some of your competitors? Would I don't know, would going to the gym be a competitor for you
Of
guys,
course.
right?
Right. Yes. So competitors can be considered, I think, either substitute services, which NovoSculpt doesn't have a true substitute to it, not a direct one. Complementary services. So things like going to the gym is a potential substitute. Of course, it's one where a significant amount of effort is needed and discipline over a very long period of time to obtain good results. Shapewear is another competitor in which people buy a binder or a faja and it gives them the shape that they want, at least temporarily. So those are competitors, right? Not particularly good ones, because as the bar elevates for everyone, people want what they want quickly, efficiently, with as little expense possible associated to it, comfortably, safely, and they want it now. And NovoSculpt is really the only service that offers things in that, or approximates that value proposition as much as possible. Other plastic surgeons' offices are competitors that they typically offer solutions that are older and not as effective or appealing as NovoSculpt, but they're still a competitor. So these are things, as we discussed at the beginning of the conversation, differentiation is a very important aspect so that the consumer understands the difference between what exists and what is new.
I mean, I think, your competitive advantage, as you said, is how instant the results are. Because if, in my world, you pay, I don't know, $2,500 for Morpheus, and you have to do 3 to 5 treatments over the course of 6 months, and then you really start to see the results. But here, you pay whatever you guys charge, and you're getting instant results instantly without having to go under anesthesia, right?
Yes, not under general anesthesia, right? We do use local anesthesia, which is very benign. It's very well managed. So, but yes, you're absolutely correct. This is different in that the reward is more immediate, and this is what people are expecting these days.
Now, could you give us a rough price point of what a typical service would cost?
Well, it varies significantly because it depends on the number of areas of the body that are attended to. For example, someone who comes in for the abdomen, in areas of the abdomen, pay as little as $3,000 to $5,000. Some people, as I said, we take care of all of the areas between the jawline and the feet. So people want sometimes the upper neck, what we call the chin here, which is upper neck, definition of the jawline, chest, back bar rolls, which is a very frequent thing in women. So as we put things together, pricing changes. So it varies very much with the individual. The good thing about NovoSculpt is that it can be tailored to exactly what the person needs and nothing more. So if a person has front bra rolls, let's say, that she's uncomfortable with, we can target just that. And that is a very economically viable proposition, which in addition to everything, NovoSculpt offers very flexible financing to amortize this expense over a period of time. So it's competitively priced in relation to potential competitors, and that's the way that we access the market, right? Because we understand that people are, their expectations are not ones of just quality. They want accessibility as well. We make that happen.
Okay, wow, great. So as we kind of tie this to a close here, what excites you most about the future of NovoSculpt and the beauty tech industry as a whole?
I think that what excites me, the horizon, as someone who I'm a fervent believer in innovation, and I think that innovation and competition ultimately benefit every consumer. It benefits all of us because it pushes us to a new horizon, areas that we perhaps initially would have been uncomfortable with. I cannot wait to see what other technological advances come into the aesthetics world, through the medical world. That is a very exciting thing. And how those will be applied to medicine and aesthetics proper. One thing that excites me very much is the prospect of robotics entering the game. So AI combined with robotics in delivering minor procedures, minor things, I think it will be a very exciting time in which physicians and clinicians, all personnel, use technology to enhance the patient experience. Right? Not to leave it to the exclusively to a technological device, a robot, but to increase the overall quality of service. These are all very exciting things that we can expect to see even in the short term, in some respects.
Now, I imagine the answer to this is no, but would insurance ever pay for this?
It's unlikely because insurance, particularly insurance in the United States, is not one that is likely to ever cover elective services. Insurance companies are very, let's use the word disciplined in order to find out whether or not a service is necessary or not. And aesthetic services are, and on some occasions they are necessary, but frequently they're not. So insurance companies are not likely to cover aesthetic services, not under the models that we know.
Figured, but it's worth a try, right?
Well, yeah. It's a good question.
So as we kind of close this out, we always like to end our podcast with rapid fire questions, quick hitters, super simple, super basic. You can answer in one word or one sentence less. So are you a morning, like early bird, or like a night owl type?
I'm a night owl.
Favorite piece of health or tech fitness or fitness tech that you're interested in right now?
There's a device that is being adopted in some gyms that makes people do reps to failure every single rep. So it's a very exciting piece of technology. I recommend looking it up. I don't quite remember the name of it. It's quite exciting.
Okay. One word your team would use to describe you.
Restless.
Best lesson you learned as a business owner.
Trust but verify. Do things yourself.
Favorite way to unwind after a long day.
Well, I practice Brazilian Jiu-Jitsu. So that is my go-to to unwind, and it's wonderful. I highly recommend it to anyone who's in a high responsibility sort of a role. It's the best way to unwind.
Grappling or sparring with someone?
Yeah. So jiu-jitsu is a grappling sport, and it's one that it's a thinking man's game. One in which you have the rare opportunity of solving things under pressure and focusing only on that. So whatever problems you have in your life, whatever worries, whatever concerns, they're all gone while you're training. And at that moment, you can only think about, what's happening at that moment, which is someone trying to strangle you, right? And you're trying to avoid it.
Or put you in an armbar.
Exactly right. Yes, see, you even have the terminology correct. Yes, an armbar or a rear naked choke or one of these things. And that's very much like meditating. You can only focus on that moment, and that's paradise.
That's all about slow breathing, not over-exuding yourself, because
Exactly.
2 minutes in, you'll find yourself drained because you didn't properly breathe and you didn't properly calm yourself during.
Right.
I used to do MMA back in the day. I've done a few amateur
So
fights, so I'm familiar with all that. So, biggest misconception about body sculpting?
Biggest misconception about body sculpting, that it's for everyone. Not everyone is a candidate for body sculpting, and realistic expectations need to accompany any process. So, if someone is heavily overweight and wants to come in and change overnight, there are limits to the technology. So that is a misconception that anyone can get it. Anyone will get the results, whatever results they want. That's a misconception.
If you weren't running NovoSculpt, what would you be doing?
I would be probably in a financial institution doing trading, or I might be in development at a technology company. One of those two things, most likely.
And then lastly, something on your bucket list.
Something on my bucket list. Well, there's so many of them, but I do want to see several places in the world that are significant to me. Parts of the Middle East I'd love to see. I would say that part of my bucket list, a very ambitious one, is to see peace in the world. That I think is an excellent one to have.
Well, that is a perfect way to end it. That's going to be a wrap on today's episode of the Striker Growthcast. A huge thank you to Roberto for sharing his journey, vision, and for leading the charge in the evolution of confidence, wellness, and modern aesthetics. If you found value in today's episode, share it with a friend who loves businesses, growth, and innovation. My name is Drew, and I'll see you next time on the Striker Growthcast.
Thank you.